kind of treatments that people know this may work, but nobody's ever seen results of working it. It does not. An infection on a foreign body, you have to take out the foreign body. It won't heal. It never will. And the faster you go for it, the lesser psychological trauma for the patient, the less scar tissue, and the better you'll be able to manage that afterwards. The same with the duration. An infected prosthesis, take it out. Have it healed for 6 months before you put a new one. Not 6 weeks, not where I cannot live with one big breast and one small. Do never take out the other one. Never take out the other one, because the last thing you want is then have trouble with the other side next time. But respect the delay. Whatever patients say, respect the delay. It has to be clean on the inside. And the only risk you have that it's going to infect again, or you have recurrence, is you not respecting the delay. Because it's somebody you know, because it's somebody you like, you think that she's sympathetic, she's young, whatever, you're going to put a new one. Too soon, you have a recurrence of infection. That is the last thing you want. The same with the necrosis. You have a tummy tuck, you have a breast lift with some necrosis. This has to heal. Scar is not that good. Leave it for half a year. That definitely, surely, all kind of infection, the inside is gone. That the scar is a bit softer again, that you can manipulate it. Never ever start with, for instance, a tummy tuck where you have some necrosis. Never ever remove the necrosis and stitch it up again. It will never work. You will have a big abscess within 3-4 days. Don't. And you will have further necrosis. Because the best way to have more necrosis is to excise and stitch it up again. Because if you have a necrosis after, in fact, what we do with the tummy tuck, what we do with the breast lift, is violating the 2 basic rules of surgery. Never close a cavity, or never leave cavities. What is a tummy tuck? And never close something under traction. 2 basic rules in all kinds of surgery, and that's what we violate every day again, because we undermine and we pull. If you have necrosis on a certain edge, this means that the very edge where you put in your stitches didn't get enough blood supply to survive, with or without eventually some extra tissue that is dying too. But the blood supply is never from perfect to 0. There is a zone in between. And there is a zone in between, and if you have necrosis, you always see that after 10 days, it seems awful, but by just leaving it, take care of it, good ointment, good care, some antibiotics, there is always going to be, let's say, half of the area that is suffering will recover.
So early debridement we shouldn't do. We should wait for mark of demarcation.
If you have no infectious problems, if pus is coming out and you have to open it.
Otherwise,
I think the longer a dry necrosis, the longer you can keep it, the better it is, because the margins can heal. If you do excise a necrosis, especially if you want to close it up again, you always have to remove far more than what will recover. And the necrosis is already because of extraction. And what are you going to see with a tummy tuck, for instance? You have some necrosis. That necrosis, it's exceptional that it's more than 0.5 centimeter. And what will become necrotic, literally that half centimeter where you put your stitches in. Because the blood supply is reduced that much that the tissue still can survive, but nothing more than that. And as you know, we need about 10% of our blood supply for nutrition and oxygen, and we need 90% for 37 degrees. But nearly all our blood supply only serves keeping up our temperature. So with 10% of your blood supply, tissues normally will survive. So if they do not, it's because they go under that 10%. But if you remove it in the next layer, you just have the same.
Yes.
You just have the same. That's also what you see. You see sometimes the white marks appearing when you even stitch deep layers. What is the let's say the vertical scarring you have when something is stitched up, let's say the old-fashioned way, where you see the marks of your stitches, that is necrosis. That is necrosis. Because if you put in a stitch and you just leave it for 10 days, no knot, you just, the needle you go through, sticks out on two ends, you leave it for 10 days, you will not have that stitch mark. You only have that stitch mark when you make a knot over it. Because the little strip of tissue within that stitch
beneath the suture, yes,
becomes
constricting,
more or less necrotic, more or less without blood supply, will survive hardly. And if you do not put your stitches too close one to the other, that's also why they say if you stitch something, you should make, if you want to put your stitches at the outside, that's the incision, you take small stitches, you put them this way. You take large bites, you put them this way. But ideally, this should be a quadrant.
Okay.
And then there is enough non-strangulated tissue left to heal. And this part of strangulated tissue will recover.
Okay.
But if you put your stitches this way,
very close, yes,
be sure
there are multiple areas of hypoxia. Yes.
Also,
Sir, another question is that you said that we should wait for 6 months if we are removing an infected breast implant.
Yeah.
So, do you think by this 6 months there will be much adhesions? So, is it possible to do after 6 weeks so that we have less adhesion, less bleeding? Or already the pocket
I think
is there?
I think you have more adhesions after 6 weeks than after 6 months.
Okay.
But I say 6 months. The only thing it opens, you have an infection, or you have an infection, it opens. That heals pretty fast. But then there is a cavity, and where an implant has been, that cavity never ever closes 100% again.
Okay.
Whether it's an elective removal or forced one, it will never ever close entirely again. And what you will have then, I'm always afraid that some germs stay asleep in that half-closed part, and that's why I wait for 6 months. Maybe it could be 3 too. I don't know. But as long as some real pocket remains, even if it's virtual, even if it's flat, even if it's nearly closed, as long as some pocket remains, there may be germs.
There may be some collection of fluids also, like seroma type of things, still not absorbed. So that may be again a source of infection for this type of things. So it's better to wait for 6 months, 100% it has closed and all infection is gone.
I wait, yes. Because the last thing you want is it infected the second time?
Yes.
Also, where you make your suture, it's very thin if you have an infection.
Thin.
Yes. You put your breast implant. That's a breast, let's say, whatever. You put your prosthesis, you put it in here. But the entrance is there. So this is stitched up. But if you have an infection, what's happening, in fact, before it opens, the prosthesis comes to the surface. So you will have your breast with your prosthesis.
Coming towards the skin.
And here it's nearly.
Near the skin.
And this is
Okay.
your suture line. So if you do, you must have enough time that this tissue grows together again, because if you open it too fast, that's also why I say, if you put in prosthesis, make a good and deep closure. Because they're going to come back for a bigger size, or they're going to come back in 10 years for a change or whatever, and you have to take the same scar. That's something people also refuse somewhere to understand, that you cannot continue and every time again put bigger and bigger and bigger, because this
area is going to be thinner.
Every time you open again, it becomes thinner. Every woman knows that you should not go over 3 cesareans, because then it becomes risky, because you have scar over scar over scar, and that the tissues become
Thin.
too much damaged and too thin to stretch and to be operated again. And every woman accepts that she should not go over 3 cesareans. But women refuse to accept that it's maybe not really possible to have 10 breast surgeries within 12 years. And every time put bigger and bigger and bigger. And there is, with a cesarean, you still stitch everything together.
Yes.
There was a lot of tractional tissues that falls away as soon as the baby is out. So a cesarean is something, even if you would not stitch it, it would heal from itself. Because there's such an excess of tissue at that moment, it all collapses and falls together.
We have a lot of tissues.
Yeah, while with the breast implant,
it's gone.
it's gone.
It's further
It's gone.
stretched.
Every time again, you
Get less tissue to close.
you make the situation, the inside, worse and worse.
Yes.
And women refuse to accept, refuse to understand this. We have somebody on the program, I think next week or in 2 weeks. 2.5 years ago, I think, April 2020, she had breast implants 440. Day on day, 3 months later, she had 825. It's too big now. Now she will have 380. 3 times opening the same incision.
With bigger and bigger.
Within 2.5 years. No, this time she's going to go smaller. But she's going to go small, but the stretched tissue and the tissue that is gone due to the traction, everything is not coming back.
Yes.
Ja?
Wij komen?
Jazeker.
En heb je gedaan, dokter?
Zijn klaar, ja?
Ik kom eten brengen voor Kuchukara die ik eten besteld.
Die is naar huis.